Menopause is a normal phenomenon, and all women will eventually go through menopause, which is basically described or defined as a lack of the menstrual period for at least 12 months. The average age in our country is somewhere around age 50, plus or minus, a year perhaps. Some women may experience menopause literally at age 35, but others may go into age 60, but the average is somewhere around 50. And then we have a term called perimenopause, which is basically around the time of menopause. And what's happening during that time typically is that a woman may experience a change in her menstrual flow, menstrual cycle. They may get prolonged, they may get very irregular. They may go, instead of 28 days plus or minus 1 or 2, they might go to 35, 38 days. They may even go to 18 or 19 days. So it becomes very chaotic and disjointed. The other thing that happens during these times is some women, not all, but some women may experience a lot of physical symptoms. They may experience hot flashes and night sweats, where they just break out at any time in these sweats, and they can't control them very well. And sometimes it can be very embarrassing and very uncomfortable as well. Some women experience where they have to throw the blankets and covers off at nighttime and even change pajamas in the middle of the night because they're just drenched with sweat. Some people experience this very seriously and really interrupts their life. There's a lot of things we do in this office. I've been doing it for over 35 years now to assess our patients and to help treat them so we can get through the symptoms better and get through this time. During these times too, there's generally a drop off in some of the production of hormones. And so women generally make a lot of estrogen and progesterone and some of the what's called metabolites of these things. And they also make testosterone just like men do, but they make perhaps a little bit more. By the way, men also make estrogen and progesterone, but they make a little less. So anyhow, during the time of perimenopause or menopause and then postmenopause, the hormones generally begin to become chaotic and generally begin to decline. One of the things that I do in this office is we actually help to supplement our patients with herbal therapies, mineral therapies, and also something called bioidentical hormones. And what these are is these are hormones such as progesterone or estrogen or testosterone or DHEA or pregnenolone and some of the other ones that are out there that we use. But we give them in something called a bioidentical form, which means they are structurally or biochemically the same in the chemical structure as what the human body normally produces when they're 20 and 30 years old. And we find it's like, look, I'm wearing glasses because my eyes aren't terrific. We need a little supplement sometimes of hormones as we go through the menopausal years, but we're not using what's called synthetic hormones, which are changed intentionally in the chemical structure so they can be patented. These ones are fraught with problems. The synthetic hormones are fraught with problems. So when people hear about in the public that, the hormones may cause cancer, they really should be saying perhaps that the synthetic hormones might cause cancer because it's something that's never been given and never been seen before in the human body. When we use the bioidenticals, which is what the female has been producing for the last 30 or 40 years now, we are using exactly what the human body's produced for all those years. And so they tend not to have the kind of side effects that synthetic hormones might actually have. So we have found that, by supplementing these things, we are able to give a lot of women back their lives again. They're more comfortable. It also can help the brain, can help the heart, can help the bones, can help their love life perhaps. And so this is a very big part of what we do in our office, to evaluate these patients on an individual basis and determine a regimen that we think is best suitable for each patient.